the Journal of American Medical Association published a report in 2015 from the UCSF showing internal documentation from the Sugar Research Foundation, talking about how there was evidence, and a ton of evidence in the literature going back to the 40s and 50s, suggesting that sugar caused heart disease. And in their own words, in their own documentation, detailing how they paid off 3 Harvard professors to falsify data and publish fraudulent studies to make it appear as if cholesterol was causing heart disease, or is at least correlated with heart disease, and exonerating sugar, even though sugar was the problem. They call this an empty calorie, okay? So that's where that phrase comes from, okay? It was one of these professors, Professor Mark, who was made head of the USDA after this, and he helped shape and author the 1977 USDA dietary recommendations to significantly reduce saturated fats and cholesterol because it caused heart disease. Okay, this changed the world. All right, so in America, we actually listen. People say, well, people just don't listen to doctors; they just eat too much fat. No, the problem is that they did listen to doctors and they stopped eating fat. And they started eating more fruits and vegetables and sugar and grains and so forth because they're just empty calories, right? No, they actually cause a significant amount of harm. Cocaine doesn't have any calories at all. So that's just a freebie. Just do as much as you want. Obviously that's not the case. There are things besides calories that affect your body. Okay, so just in America, after the 1977 proclamation that cholesterol caused heart disease and we should stop eating that and saturated fat, the American population, hundreds of millions of people, reduced our fat and cholesterol intake by 30% and reduced red meat by 33% because, of course, red meat has a lot of fat and cholesterol, so, of course, that's the worst, right? Actually, it's the best. And we increased our fruits and vegetables by 30 and 40% respectively, increased grains and sugars as well. And what happened? What were the results of this? Okay. Well, first of all, heart disease rates tripled, okay? And all countries that followed these dietary practices found the same results, and also obesity and heart disease, diabetes, stroke, Alzheimer's, Parkinson's, autism, all these things all increased exponentially, as well as autoimmune diseases. Okay, so all these things all increased at the exact same time, but important to this topic, heart disease rates tripled. Okay, so you can't say that cholesterol causes heart disease if you reduce cholesterol and heart disease rates increase. If anything, you say that's protective, and in fact, that's what we're actually seeing in the literature. Okay, so another piece of fraud and misrepresentation was of the Framingham study, which is a large 30 year study that is one of the cardinal studies in cardiology. Okay, so these results actually were misrepresented by the American Heart Association, which is pretty incredible. Okay, so the original Framingham study actually found that if you dropped your total cholesterol by 1 milligram per deciliter, you actually increase your coronary mortality and total mortality by 11%, okay? So as your cholesterol went down, your mortality rate went up and heart disease deaths went up, okay? That's significant, okay? But the American Heart Association 2 years later fraudulently claimed that the Framingham study found that a 1% drop in total cholesterol equated to a 2% drop in coronary heart disease risk. Okay, that's academic malpractice. All right, that's fraud. Okay, another very famous researcher was Ansel Keys. This guy is the guy who came up with the recommended daily allowances, and so he was quite well known. He did something called the 7 Nations study, where they found 7 nations, and as you increase the amount of cholesterol that they had in the population, you also saw this parabolic increase of heart disease as well. So they said, oh, look at that, that's conclusive. Well, no, that's a correlation, that's not a causation. And the problem with this is that he had data, full data for 23 countries, not just the 7 that he used. And if you plotted all 23 of those, there isn't even a correlation. It's scattered all over the map. So there isn't even a correlation. They've known this for 60 years now, that there's no correlation between increased cholesterol and heart disease, okay? And it turns out that he was actually a paid shill by the sugar industry as well. He's bought and paid for. This is a matter of record.